Good evening, and thanks for having me back. I'm Gonzales, Public Health Director. I do want to give you a couple areas of focus tonight. One is our COVID-19 metrics. Where are we at with the metrics now post-December holidays? And then the big one, the vaccine, the light at the end of the tunnel. We're still in the tunnel, but where are we at with the vaccine and the distribution and the planning of that? Update on the metrics. And we'll have a few other slides, but you see this on our dashboard. This was a snapshot of yesterday. You see the case rate. It's been sticking right around that 400 per 100,000. We'll talk more about that. Some good news, our hospitalizations of COVID-19 have been slowly declining, kind of bouncing around 50, but nowhere near where we were in late November, early December with 122 in the hospitals. And our ICU utilization has been much better situation, well below 85%. If you recall, a couple of weeks ago, we jumped them into the 90%. Very, very scary. I had opportunity to visit the ICUs, and it was very eye-opening. Our healthcare workers are heroes. They're working around the clock. They're tired, but this has given them a little bit of room to breathe. And we got to continue this good work. Right here, we're in kind of a real important time where vaccines are coming in, but we still have the virus, and now we have variants of viruses. We got to make sure we keep our case rate down and keep our healthcare workers not only able to treat COVID-19, but anybody that has a medical emergency. And our test positivity has dropped down significantly there. And late November, early December was up to 13%. So down to 6.5. We'd love to see it below 5. Got a little bit of work to do there as well. This just showing the graph of the our case rate. You can see the devastating post-Halloween timeframe that gave us that big surge, our third wave per se, the largest right around 1,000 per 100,000. That then related to many hospitalizations, and we'll talk later, unfortunately, deaths. We did do a great job. You see a little bit, we come down after Thanksgiving, just a little uptick there right after the Thanksgiving holiday, and then a steady decline. That's when we were in the level red. Everybody did a fantastic job here in Larimer County, we always do. Tons of sacrifices by our businesses, tens of sacrifices by families, everyone, to get us back down. And then we're just seeing a little uptick of the post-December holidays, but we're plateauing. We're not seeing us going back down. We're staying right there at the 400,000. So a little bit of work there to get it down. If you recall, to get us into actual orange level where we meet those metrics, we need to be below 350 per 100,000. So we're asking for everyone's continued help there. This is a slide our epidemiologist, Dr. Olson, put together. It's really fascinating. I'll go over it real quick. The green line is our actual cases. You see where we were in the dial level red, and then you'll see where we came out of the red, and that was by the governor's order, moving all the 32 counties that were in red to orange. We, for 3 days, actually met orange a couple of weeks ago and then slowly crept back up to that red. But then you see some other trajectories. The blue is post 4th of July, the orangish kind of burnt orange color post Halloween, and then post Thanksgiving. So we were kind of right after the December holidays, following that post 4th of July, got me really nervous. But we've now plateaued. So my hope here is it'll drop off like the post-Thanksgiving. Would be great to see us down below 200 per 100,000. So this is just kind of a visual of those case jump, those spikes after those post-holiday events. Now, I'd like to take a pause here. We have had 178 deaths attributed to COVID-19 in Larimer County. We've had just under 5,400 deaths attributed to COVID-19 in Colorado, and we're now over 400,000 as a nation. Lots of loss of life due to communicable disease. Our hearts go out to everyone that's lost a loved one, friend, family member, et cetera, to this deadly virus. I sincerely hope we can continue to curb this virus and reduce the loss of life. You'll see November and December was very deadly for us, that post-Halloween surge. 61% of our 178 deaths occurred in those 2 months. I take this very seriously. Our goal here is to have nothing like this ever again. So I'm asking for everyone to continue to stay diligent, keep it to one household, minimize your exposure outside of your home, wear your face covering, wash your hands. I know we're all tired of this, but everything you do, that saves lives. And we certainly don't want to see another wave and something like we experienced in November and December. I know across the country today, lights are being shown in the memory of all the loss of life in the United States and around the globe of this global pandemic due to the loss of life. So hopefully with the vaccine, there's that light at the end of the tunnel. Now, what Colorado is doing something really, really good. As you can see here, this graph compares hospitalizations in Colorado and the US, Colorado being the greenish color, US, the purplish blue. You'll see where we were actually increasing at a rate higher than the United States as a whole, right there, November, early December. Went to that level red, the painful level red, significantly drop off in Colorado, where the US continues to climb. I'll tell you, folks, if we were climbing with the US as it is, our hospitals could not meet demands. They couldn't meet daily medical needs. We did it right here. I'm so proud of Colorado. I'm so proud of the hard work. I'm seeing a little bit of an uptick lately, but we're hopeful that it's just a little uptick, just a blemish, but we'll start continuing to go down. This, again, has given our healthcare workers an opportunity to breathe and save life. We have a lot more loss of life if we were on the trajectory with the US. I know it's been hard, but this graph tells it all. There's two directories, Colorado, the rest of the US. So I appreciate all the work there. Moving from metrics to our vaccine update. Before I get into the vaccine distribution and the planning, the way it's set up is the federal government is distributing the vaccine, and the state governors are the ones that determine the final prioritization of the distribution. Now, the governor's policy group, as well as Colorado Department of Public Health and all my colleagues around the state, local public health, we've prioritized by two overarching kind of framework. Let's save the most lives and end the pandemic as quickly as possible. So when we show you the prioritization, the plan, and those that fit in the certain aspects of the phase 1, 2, and 3, let's keep that in mind. Our goal is to save the most lives and end the pandemic as quickly as possible. You've probably all seen this, or the phase for Colorado, and who's eligible in what phase. Phase 1 is that winter phase, 1A, 1B above the dotted line, and then 1B below the dotted line. Phase 2 in the spring, and then phase 3, which would be the general public. Let's focus in on that phase 1A and phase 1B first. Phase 1A is the high-risk healthcare workers and individuals and long-term care facility staff and residents, and we'll talk specifically more on that. We're doing a great job in this important area. Then the phase 1B above the line, that's Coloradoans age 70 or older, and the governor has put together a wildly important goal that we get that group, our most vulnerable, to this disease where we see more hospitalizations and more death. In Larimer County, 80% of our deaths have been at the age 70 or older. Now, the age range, our youngest is 30, and our oldest is 103 that we lost a life. But overall, that over 70 or older, they're the ones that really, really suffer and end up loss of life. So we're targeting that group, and the governor wants us to have 70% of those individuals 70 and older vaccinated by February 28th. It's a great goal, so we're working hard. Then also those moderate risk healthcare workers, first responders, EMS, mental health. And that includes our dentists, our hospice providers, our mental health, dermatologists, firefighters, police, correctional workers, funeral services. So we're going to talk about that group right now, and that's the one we're focusing in on right now as we deliver shots in the arm. Let's talk long-term care facilities. This has been devastating, especially here in Larimer County. We have had nearly 53% of lost life, and maybe even more now, residents in long-term care facilities. This has been very, very difficult for our long-term care facilities. Some have lost up to a third of their residents at any given time. The staff have been working hard. It's if you would imagine just the morale in these facilities. We need to get everyone in these facilities vaccinated and get vaccinated quickly. Luckily, that's through a federal project with contracts with Walgreens and CVS, and that's a partnership with the state and the feds. We have 54 long-term care and other residential facilities. All of these are getting their first round and should be done by January 27th, first round of the vaccine. And the goal is by the end of February, early March, to have the second dose. So that most vulnerable group is underway right now. I hope to have that wrapped up with the second dose by the end of February. Now, it's really important to understand the 65,000 doses Colorado is receiving currently a week. 6,500 or so come to Larimer County. So it's very limited. We're getting lots of calls. Hey, I want the vaccine. I want to give you the vaccine. We're planning for you, but we're only getting a small amount. And I try to tell people this is a global pandemic. We're trying to vaccinate the world. We've never done this before. We've vaccinated large areas, whether that was smallpox or polio, but not the whole world. So this has been one of those big global challenges. But when the vaccine does come to the local communities, 50% currently is going to the hospitals in large healthcare systems, 20% to our federally qualified healthcare centers. That includes Salud for Fort Collins, Estes Park, Wellington area, and then Sunrise for Loveland, Berthoud, and Timnath area. So those are our two FQHCs. Then 20% to pharmacies, and then 10% to the local public health department, to my department. So that's how right now it is being distributed. Now, we each have our roles. We got this 1A and 1B. It's a pretty big group. So local public health, we're right now, our responsibility is that finalizing any gaps in the 1A, making sure we're getting everybody there, no one's falling through the cracks. And then the moderate risk healthcare for workers in phase 1B. Excited, our staff gave over 150 vaccine today, and they're going to do 400 tomorrow at the ranch. We're getting dentists, mental health providers. We vaccinated our first school nurse because those school nurses are high risk because they're administering the Binax rapid tests at Poudre School District, Thompson, Estes, and some of our private schools. So we're excited to have that today. And then our first responders, we're making sure our EMS, our fire, police, that they're all getting their vaccines. And then our providers, our hospitals, health systems, our pharmacies, FQHCs, they're making sure they get the people 70 years and older. I want to give you some data here. When we say people 70 years and older in Larimer County, what does that mean? That's 40,000 people. And we need to get 70% of them, at least, more would be better, by February 28th. Now, when we're talking about our outstanding, our moderate risk healthcare workers, we have 1,200 dentists signed up, 1,800 home health hospice, over 200 mental health. So we're talking significant amount of people that we are vaccinating right now, and then we got to do 2 doses. But we're working on it, and we're getting there. And I want to make sure everyone knows we don't have doses sitting around. We meet with our providers, and we'll talk more about that weekly, actually now twice a week. And every Friday we ask, do you have doses sitting around? Because if not, we've got to get them in the arms. Last Friday, maybe 1 vial, nothing really substantial. We are getting them in the arms of people, and we're doing it very quickly. So I'm very proud of all our providers here in Larimer County. Let's talk a little bit timeline. So here's the 1A estimates for Colorado total, about 187,000. Remember the long-term care that's being done through the federal partnership. But the goal there is to get through this by end of February, have 1A completely done. So that's going along pretty good. Now 1B, the estimates here in Colorado is 1.3 million. And coming back, when we just look at our moderate risk healthcare and our people 70 or older, we're estimating that's about 50,000 people here in Larimer County. Then the frontline workers, that's that lower part of 1B, that'll be that mixed group that we all want to start beginning in March 1st. Just our educators, and it's so important. I am advocating to get our educators the vaccine as soon as possible, as soon as we get it. We have 9,100 educators. And, that's teachers, custodial staff, bus drivers, coaches, you name it. So we'll be trying to get that group starting 1st of March. And then all the other frontline essential workers. That's going to be a big number, but we're looking forward to it. So we're being told that in a week or two, we should see more vaccine coming to the state, about 1 million more throughout the United States. I don't know what that'll relate to Colorado, but it'll be more. We're also hearing from now the Biden administration to the state health department that other manufacturers should be seeking their approval from the FDA middle of February, like Johnson & Johnson or some others. And that will increase our vaccine just because we'll have more manufacturers. So hopefully by third week in February, we're going to see a lot more than 6,500 doses coming to Larimer County per week. And that would certainly help us with our timeline. Just a note, if you're curious about statewide data, you can just go to the CDPHE website. They've got a really nice dashboard available. It shows how many people have been vaccinated, first and second dose, and what phases we are. And we're in phase 1A and 1B above the dotted line. This just show you some progress we're doing here in Larimer County. Now, is it perfect? No, but boy, we're getting better all the time. You can see our shots in the arms just increasing. And we haven't really been receiving any more vaccine. We're just getting better and more efficient with all our providers. We're pretty excited. We've got about just over 5% of the population vaccinated. Just under 18,000 have received their first dose in that 1A, upper 1B. And we're starting to get the second dose, and that's going to jump up this week as the Moderna and Pfizer. Pfizer, it's 21 days after. Moderna is 28 days after you get your initial shot. You got to get the second. So we're starting to see that climb, or just under 4,000 for first and second shot. And as I said, tomorrow we'll be doing a big vaccination clinic out in the ranch for that upper 1B group. Already told you 21, 28. Again, the governor is really challenging us all in a very good way to maximize and be efficient in Colorado. Overall, Colorado's in the top 10 of getting shots in the arm out of our 50 states. I think we're 8th right now. Now, certainly we could do better. I'd love to be number 1. So we're working on ways we can even do a better job. That was our meeting we had today with all our providers on ways we can even increase our efficiency to get the vaccine in people's arms. Goals here, just a little more goals. We're adding more providers as they come. We've got information I'll share with you. If you are potentially a provider, we can get you in the queue and then get state approval so you can help us with the distribution. The more, the merrier. Again, we're meeting weekly with all of our providers, planning events, and making sure we're not missing anybody along the way. We're at the health department. Like I said, today we had a clinic. Tomorrow we have more of a mass clinic, and we're even looking at ways we can partner up with Weld County, and because Banner and UC Health, we share the hospital system. How can we even be more collaborative across boundaries to get this vaccine out? And big one we got to work on is working to address transportation access barriers. We just can't say, come here, get your vaccine. We know some people maybe don't have a car. Some people can't drive. Maybe there's some needs that we've got to address. So we're going to be working as a community on how we bring the vaccine to people so everybody has an opportunity for the vaccine. Okay, so what's next? That's at phase 1B below the dotted line here where the yellow square is. It's a big group, like I said, just right off the bat, 9,100 educators. But we met today with all our partners as well as Weld County to start planning for mass points of distribution. The goal here is we're going to be going 6-7 days a week. We're going to be vaccinating this group in masses. And so we need a plan together. That plan is being drafted right now. We're going to get that to the policy group at the state health department, to the governor's office, so we can show that we are able to mass vaccinate and be able that we have a plan for this group. But I know there is some frustration. Hey, when do I get vaccinated? I understand that and I empathize. It's the limited vaccine right now is the barrier. As soon as we start getting more vaccine, we're going to be ready. And we're planning for you right now to make sure we get to the lower 1B. And then phase 2, we can't wait. We start getting more vaccine out into our community. And we're going to make sure we're doing that with an equity lens. All of our providers, we're talking about that and making sure we get out this in an equitable manner. I want to make sure everyone knows, if you believe you're a provider or person in a 1A or 1B, and you don't know what to do, please come to our website, larimer.org. At the top banner, it says COVID-19. Click on that. It's one click. Second click, click on vaccines. You're going to see a couple JOT surveys. If you're a 1A or 1B, go in there and complete the survey. It takes 5 minutes and fill that out. That puts you in the system and gets you in the queue. And then my staff will contact you and coordinate things as vaccine becomes more readily available. Now, you're 70 and older, and you have internet access, there's a survey for you online as well. Click on that, get in the queue. We want to make sure we get your name to UC Health, Banner, Salute, whomever, to get you vaccinated. You probably won't get a call from my department, because remember, the healthcare systems are the one vaccinating 70 and older, but we want to make sure you're not forgotten. Now, if you don't have internet access, I think it's the next slide. I think we added a new slide here with the phone number. Yes, there it is. Thank you, Corey. Please call us at 970-498-5500. That's Monday through Friday, 9 to 4:30. My staff, you're going to get a live person from the Joint Information Center. They'll get your information, get it into the system, and give you instructions. You can also text. You got the ability. Text at 970-999-1770, or email us at publichealth@larimer.org. We want to make sure we get your information and get you in the queue, because we're vaccinating 70 and older, and we want to meet the governor's wildly important goals. So make sure we get this out. We're going to be working with the Office of Aging and other organizations and non-for-profits to make sure we get this out for all of our 40,000 residents that are 70 and older. Also, to our Spanish-speaking Latinx community, our teams put together a community forum that'll be in Spanish with our Dr. Urbina, who's our health officer, and on our team that they speak Spanish. That's going to be Wednesday, January 27th from 6 to 7. It'll be it's Facebook Live at Larimer Health. But please, if you know friends that speak Spanish, we want them to get this information as well. It's very important they understand how to sign up, what's the next steps. So that'll be Wednesday, January 27th. Just a reminder, ways to prevent the spread of the virus. Again, we are really in an important area, time of the pandemic, as vaccines are coming available, the light at the end of the tunnel, but we still have to be more diligent than ever. We do want to see our cases increase, and things have to roll back while we're trying to vaccinate the most vulnerable. So just a reminder to wash your hands, wear your face coverings, stay 6 feet apart, and stay home if you're feeling sick for sure.